My name is Paul Anderson. I'm an oral and maxillofacial surgeon here in Peachtree City at Peachtree Oral and Facial Surgery. A little background on me. I grew up in southern Kentucky in two small communities. I grew up with a love of baseball and history and science. Also loved being outdoors, loved activities, loved bike riding. Very rambunctious as a preteen and teenager as far as physical activities were concerned. I was hoping to go into architecture as I got into my high school years. Was also hoping to play professional baseball, and somewhere that went awry. But anyway, I still love baseball, still love to horse around with, I guess, softball at this point, if my wife will let me. And still have a passion for history, also reading and drawing. Architecture is a fascination as well, but when I got into college, I decided that it really wasn't for me. Maybe I could do something else. And it's kind of between ortho and orthodontics and law. And somewhere along the way, I made the decision that when I really want to be a lawyer, I had a couple of friends that were going into dental school, and I was like, well, I don't know if I want to be a dentist, but I could probably be an orthodontist. That seems pretty cool. I liked my orthodontist growing up. Why not? So I got into dental school at the University of Kentucky, and I had gone to undergrad at the University of Kentucky mostly, and I decided that while I was there, ortho wasn't all that interesting. And at the end of my second year, I got to do a rotation in oral surgery with the residents at the University of Kentucky, and they basically just let me go to the ER and see the patients that were coming in that they were being consulted on. So I was immediately fascinated with facial trauma. I got to sew up a couple of facial lacerations, and we did a couple of jaw fractures and nasal fractures, as well as I think a cheekbone fracture. So I was kind of hooked at that point. So my focus in my last 2 years of dental school was, okay, how can I get into oral surgery, and where do I need to go to get the training that I want? So I finished dental school and ended up interviewing at about 15 different places. And on one of my interviews, I got there, and the Sun Times did a huge expose on a cleft lip and palate patient that was being done at the University of Maryland, and I was like, wow, this is really cool. And I actually got to meet Dr. Ben Carson while I was there as well, and that was sort of a awesome experience in and of itself that day. So I ended up putting down about 7 different oral surgery programs, and I matched with the University of Maryland and went there to train. It was a 6-year MD integrated, so I also went to medical school there. Really enjoyed my medical school. I enjoyed my general surgery experience. We had to do almost 18 months of general surgery at the end of the day, and that part was amazing. Our oral surgery part was very heavily centered on head and neck cancer, and also on head and neck trauma and reconstruction. And so it kind of fed my previous interest from dental school in head and neck trauma. Interestingly enough, even though we did do cleft palate cases when I first got there, that sort of kind of disappeared as I got there, although that was always an interest of mine. I ended up getting out and finishing my program in early 2001, and decided to make my way to the Atlanta metropolitan area, where I became a part-time attending at Emory University, where I got to do more head and neck trauma at Grady. Loved it. I still do trauma, but I do it here at Piedmont, Fayette. Somewhere along the way, I met my wife, and we have 4 beautiful daughters. Pretty much take up all my time once I leave here, and they keep me very busy. I do a lot of nails, hair, playing with dolls, all the fun things that as a guy growing up I probably got very little exposure to. But it's kind of a joy every day to see when you go home what's happening in the house, because they don't really care what I do at work. And here comes Dad, and they jump on Dad as soon as I walk in the door, which is probably the best feeling on earth, I gotta say, and that's probably not something I expected. At work here, we have a great team. I love what we do. We try to really make a difference in people's lives. I think that's the part that's worth it. As a private practice, we practice full scope, but we don't always do full scope. We do try to center on implants and reconstruction. I love seeing somebody happy with what we can do for them. that being said, that's me in a nutshell. I would look forward to meeting you sometime in the future if there's something that you think we can help you with.